This is why you need Botox for your TMJ and jaw joint pain. So you may have heard about Botox, typically for the cosmetic reasons, whether you've got wrinkles, whether you have the 11s or crow's eyes or the corner of your mouth, laugh lines, sweaty armpits. There's a lot of reasons for Botox. We don't do Botox for sweaty armpits in my office. That's beyond my scope. But as far as cosmetic Botox, it's a phenomenal option. But one thing that most people don't know is that Botox is also a great treatment for jaw pain. We have a lot of patients that clench, a lot of patients that grind, and it can lead to headaches. It can lead to poor sleep quality, insomnia, tiredness the next day, just overall general fatigue and malaise, and all of it can stem from the clenching and grinding. So my first go-to with most patients that present with jaw joint pain is some kind of splint therapy, which is usually a night guard that prevents those muscles from firing off. But sometimes, whether it's through tension, whether it's lifestyle or something else going on, a night guard is not enough. And so I'm going to start by talking a little bit about the jaw joint and the muscles. It's a really complicated joint. So if you think about it, your elbow is a hinge. You hinge just one direction. Your shoulder is a ball and socket, so it rotates around in a circle. The jaw joint is kind of a combination of those, and it's got a sliding component to it. So you've got your head, your skull, and then your condyle, your bottom jaw, comes up and kind of sits in a fossa, and there's a little tiny disc that kind of acts as a cushion, a shock absorber, if you will. And so when your jaw joint moves, that ball moves around, and that little TMJ capsule kind of protects everything. But over time, that joint can take a real beating and a pounding, and that little tiny ligament can really get worn down. And so what happens is opening becomes painful, clenching becomes painful, and even just any kind of strenuous use of your mouth can really cause discomfort. So the way that the mouth works is that there are four main muscles of mastication. That means there's four muscles involved in chewing. The biggest one is going to be your master. It's this big fat muscle right here. And a lot of times you might notice in people that clench or grind, it's actually kind of hypertrophy. That means it's gotten bigger. It's almost like a weightlifter that constantly lifts and grows the muscle. Sometimes this jaw joint can be the exact same way. A secondary muscle that helps with opening and closing the mouth is your temporalis. So a lot of times when people have tension headaches or they have a lot of stress and they feel it in this area, it can be actually caused by clenching and really squeezing hard. And you have two other minor muscles, but they're on the inside. We're not going to worry about those. So when we do Botox for jaw joint pain, we're focusing on the temporalis muscle and the masseter muscle. And this big guy, he's the main culprit. And a lot of times people will come in and say, my right side of my jaw hurts, what can we do about it? And so we go down the treatment tree and we talk about, night guard and everything. And if we determine that Botox is the right treatment for you, they're like, well, can I just get it in my right one because that's the only one that hurts? And that's absolutely not okay. It's really important that when we do Botox, we treat it bilaterally, because if you just treat one side, it can throw the whole alignment of the jaw joint off. So that's just a little tidbit. If you do ever go somewhere for TMJ and they only want to do that one side with Botox, I would definitely recommend seeking a second opinion. So the other question I get is Botox, that's poison, right? You're going to put poison in my mouth. That's not it at all. So Botox is basically, the best way to think of it is it just takes a little bit off the amount of the muscle contraction. So if you do Botox, you're still going to be able to chew, you're still going to be able to talk, you're not going to be slack-jawed, you're not going to be droopy. Basically all it does is it just reduces the force of the contraction of those muscles. So we basically do the base of the masseter and the top of the masseter, which is this big muscle right here that does the bulk of opening and closing. And then also the temporalis muscle, which is right here, right next to your temples, and that does also, it's a fan-shaped muscle that also helps with the opening and closing. And those are the two main culprits, if you will, that cause kind of tension headaches and jaw pain. So typically for cosmetics, when we do Botox, we do about 20 to 30 through this area, just depending on the depth and the amount of damage over time those muscles have caused. And elsewhere on the face, 5 to 10 units here or there. When we do Botox for TMJ, we're going to use about 100 units, because you want to put about 30 in your temporalis muscles and 70, so about 35 on each side. So it's a significantly larger dose. Now it's not dangerous. I think I read somewhere you'd have to have 100 bottles of Botox to even approach any kind of toxic level. So it's very safe, but there's significantly more that we use on these muscles because we're really trying to overcome that really strong force of contraction. I generally like to tell patients, let's give it 2 weeks to really get the profound impact of that reduced muscle contraction. And a lot of times when we combine Botox with a night guard, we can almost eliminate any of the nighttime clenching and grinding and residual muscle soreness in the morning. So how long does Botox last? Great question. Most people will burn through their Botox in about 3 months, just depending, 3 to 6 months, depending on your body, depending on if you've used it for a long time. And the nice thing about Botox, when we use it for therapeutic reasons, is that first dose is always going to be the biggest. So when you start to notice at about 6 months, hey, I'm starting to clench a little bit, my muscle contraction is a little bit stronger, we can have you come in and use a little bit less of a dosage because the muscles are already a little bit less strong than they were. Another side effect that we noticed that's actually pretty beneficial is a lot of patients that have built up these big, strong masseter muscles, when we start using the Botox, they'll actually see those muscles shrink in and kind of give the face a little bit more of a sleeker aesthetic look. So if you're worried about getting Botox in so many units here, don't worry, it's not going to make you look all face pulled back or make you look permanently surprised. It really is located in just these areas. Now, if you want Botox in the cosmetic areas, that's absolutely something we can do, and I'll sit down with you and we can discuss which lines, which wrinkles, which areas of your face you're not happy with. But if you have a concern about being plastered back in a permanent surprise look, don't worry. Botox for therapeutic uses will not change the ability to move your face or smile or move any other facial muscles. Another use for Botox for TMJ or jaw joint pain is limited opening. We had one of our patients that had a very limited opening. They were barely able to open their mouth, which is problematic not only for just proper hygiene, but also just eating and chewing and daily function. So by using Botox, we were actually able to get those muscles to relax and allow her to kind of stretch and increase her range of motion. And actually, it just took one treatment of Botox, and that was about 3 to 4 years ago, and she's still got a great range of motion now. So if you don't have a limited opening, that doesn't sound like that big of an impact, but I can tell you it was absolutely life-changing because she was able to barely open to get food in there. She was having to cut her food with a fork. She couldn't open. And actually she sent me a picture a couple weeks ago of her opening wide for a big sandwich. So, I mean, it sounds cheesy, but it was absolutely life-changing for her. So if you're in that situation and you're stressed, you're worried, you're trying to figure out why you can't open as wide, why your jaw hurts, why your mouth is sore, give us a call. We'd love to have you come see us, and we'll sit down and talk about our options. So if you find yourself with jaw pain, with muscle soreness, even kind of touching and squeezing the muscle inside your mouth causes a lot of pain, and you're stressed and you're worried about what you can do, come see us. Maybe a little bit of Botox is the right solution to get you back on track. I'm Dr. Brett Langston, and this is Oakley, and we're here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on thoughts, the dumbest you've ever seen.